NCELX Daily Practice Test Part 6. 101. An 18-year-old client is admitted to intensive care from the emergency room following a diving accident. The injury is suspected to be at the level of the second cervical vertebrae. The nurse's priority assessment should be the client's A. Response to stimuli. B. Bladder control. C. Respiratory function. D. Muscle weakness. 101C. Respiratory function. Spinal injury at the C2 level results in quadriplegia. While the client will experience all of the problems identified, respiratory assessment is a priority. 102. A client has been admitted to the coronary care unit with a myocardial infarction. Which nursing diagnosis should have priority? A. Pain related to ischemia. B. Risk for altered elimination, constipation. C. Risk for complication, dysrhythmias. D. Anxiety related to pain. 102A. Pain related to ischemia. Pain is related to ischemia of the heart muscle, and relief of pain will decrease myocardial oxygen demands, reduce blood pressure and heart rate, and relieve anxiety. Pain also stimulates the sympathetic nervous system and increased preload, further increasing myocardial demands. 103. The nurse is caring for a client with a distal tibia fracture. The client has had a closed reduction and application of a toe to groin cast. 36 hours after surgery, the client suddenly becomes confused, short of breath, and spikes a temperature of 103 degrees Fahrenheit. The first assessment the nurse should perform is A. Orientation to time, place, and person. B. Pulse oximetry. C. Circulation to casted extremity. D. Blood pressure. 103B. Pulse oximetry. Restlessness, confusion, irritability, and disorientation may be the first signs of fat embolism syndrome, followed by a very high temperature. The nurse needs to confirm hypoxia first. 104. The nurse is assessing a client with a stage 2 skin ulcer. Which of the following treatments is most effective to promote healing? A. Covering the wound with a dry dressing. B. Using hydrogen peroxide soak. C. Leaving the area open to dry. D. Applying a hydrocolloid or foam dressing. 104D. Applying a hydrocolloid or foam dressing. While the previously accepted treatment was a transparent cover, evidence now indicates that the foam, duoderm, dressings work best. 105. A client is recovering from a thyroidectomy. While monitoring the client's initial post-operative condition, which of the following should the nurse report immediately? A. Tetany and paresthesia. B. Mild stridor and hoarseness. C. Irritability and insomnia. D. Headache and nausea. 105A. Tetany and paresthesia. Because the parathyroid gland may be damaged in this surgery, secondary hypocalcemia may occur. Findings of hypoparathyroidism include tetany, paresthesia, muscle cramps, and seizures. 106. A client is scheduled for an intravenous Pilogram, IVP. Which of the following data from the client's history indicate a potential hazard for this test? A. Reflex incontinence. B. Allergy to shellfish. C. Claustrophobia. D. Hypertension. 106B. Allergy to shellfish. It is important to know if the client has an allergy to iodine or shellfish. If the client does, they may have an allergic reaction to the IVP contrast dye injected during the procedure. 107. A client enters the emergency department unconscious via ambulance. What document should be given priority to guide the direction of care for this client? A. The Statement of Client Rights and the Client's Self-Determination Act. B. Orders written by the provider. C. A notarized original of advance directives brought in by the partner. D. The clinical pathway protocol of the agency and the emergency department. 107 C. A notarized original of advance directives brought in by the partner. This document specifies the client's wishes. 108 A client diagnosed with hepatitis C discusses his health history with the admitting nurse. The nurse should recognize which statement by the client as the most important. A. I got back from Central America a few weeks ago. B. I had the best raw oysters last week. C. I have many different sex partners. D. I had a blood transfusion 15 years ago. 108D. I had a blood transfusion 15 years ago. The client who was transfused prior to blood screening for hepatitis C may show findings many years later. Options B and C are associated with risk of hepatitis B. 109 Which of these children at the site of a disaster at a child daycare center would the triage nurse put in the treat last category? A. An infant with intermittent bulging anterior fontanelle between crying episodes. B. A toddler with severe deep abrasions over 98% of the body. C. A preschooler with a lower leg fracture on one side and an upper leg fracture on the other. D. A school-aged child with singed eyebrows and hair on the arms. 109 B. A toddler with severe deep abrasions over 98% of the body. This child has the least chance of survival. Severe deep abrasions should be thought of as second and third degree burns. The child has great risk of both shock and infection combined. 110 A client has returned to the unit following a renal biopsy. Which of the following nursing interventions is appropriate? A. Ambulate the client 4 hours after procedure. B. Maintain client on NPO status for 24 hours. C. Monitor vital signs. D. Change dressing every 8 hours. 110C. Monitor vital signs. The potential complication of this procedure is internal hemorrhage. Monitoring vital signs is critical to detect early indications of bleeding. 111. The nurse is providing instructions for a client with asthma. Which of the following should the client monitor on a daily basis? A. Respiratory rate. B. Peak airflow volumes. C. Pulse oximetry. D. Skin color. 111B. Peak airflow volumes. The peak airflow volume decreases about 24 hours before clinical manifestations of exacerbation of asthma. 112. A client with a documented pulmonary embolism has the following arterial blood gases: PO2 70 mm of mercury, PCO2 32 mm of mercury, pH 7.45, SAW2 87%, HCO3 22. Based on these data, what is the first nursing action? A. Review other lab data. B. Notify the healthcare provider. C. Administer oxygen. D. Calm the client. 112C. Administer oxygen. The client has a low PCO2 due to increased respiratory rate from the hypoxemia and signs of respiratory alkalosis. Immediate intervention is indicated. 113. The nurse is teaching a newly diagnosed asthma client on how to use a peak flow meter. The nurse explains that this should be used to A. Determine oxygen saturation. B. Measure forced expiratory volume. C. Monitor atmosphere for presence of allergens. D. Provide metered doses for inhaled bronchodilator. 113B. Measure forced expiratory volume. The peak flow meter is used to measure peak expiratory flow volume. It provides useful information about the presence and/or severity of airway obstruction. 114. The nurse is assessing a 55-year-old female client who is scheduled for abdominal surgery. Which of the following information would indicate that the client is at risk for thrombus formation in the postoperative period? A. Estrogen replacement therapy. B. 10% less than ideal body weight. C. Hypersensitivity to heparin. D. History of hepatitis. 114A. Estrogen replacement therapy. Estrogen increases the hypercoagulability of the blood and increased the risk for development of thrombophlebitis. 115. During the checkup of a 2-month-old infant at a well baby clinic, the mother expresses concern to the nurse because a flat pink birthmark on the baby's forehead and eyelid has not gone away. What is an appropriate response by the nurse? A. Mongolian spots are a normal finding in dark-skinned children. B. Port wine stains are often associated with other malformations. C. Telangiectatic nevi are normal and will disappear as the baby grows. D. The child is too young for consideration of surgical removal of these at this time. 115C. Telangiectatic nevi, salmon patch or stork bite birthmarks, are a normal variation and the facial nevi will generally disappear by ages 1 to 2 years. 116. A 3-year-old child diagnosed as having celiac disease attends a daycare center. Which of the following would be an appropriate snack? A. Cheese crackers. B. Peanut butter sandwich. C. Potato chips. D. Vanilla cookies. 116C. Children with celiac disease should eat a gluten-free diet. Gluten is found mainly in grains of wheat and rye and in smaller quantities in barley and oats. Corn, rice, soybeans and potatoes are digestible by persons with celiac disease, F.A. Davis Company. 117. A nurse assigned to a manipulative client for 5 days becomes aware of feelings of reluctance to interact with the client. The next action by the nurse should be to A. Discuss the feeling of reluctance with an objective peer or supervisor. B. Limit contacts with the client to avoid reinforcement of the manipulative behavior. C. Confront the client about the negative effects of behaviors on other clients and staff. D. Develop a behavior modification plan that will promote more functional behavior. 117A. Discuss the feeling of reluctance with an objective peer or supervisor. The nurse who experiences stress in the therapeutic relationship can gain objectivity through supervision. The nurse must attempt to discover attitudes and feelings in the self that influence the nurse-client relationship. 118. A client is being treated for paranoid schizophrenia. When the client became loud and boisterous, the nurse immediately placed him in seclusion as a precautionary measure. The client willingly complied. The nurse's action A. May result in charges of unlawful seclusion and restraint. B. Leaves the nurse vulnerable for charges of assault and battery. C. Was appropriate in view of a client history of violence. D. Was necessary to maintain the therapeutic milieu of the unit. 118A. May result in charges of unlawful seclusion and restraint. Seclusion should only be used when there is an immediate threat of violence or threatening behavior toward the staff, the other clients, or the client himself. 119. The provisions of the Law for the Americans with Disabilities Act require nurse managers to A. Maintain an environment free from associated hazards. B. Provide reasonable accommodations for disabled individuals. C. Make all necessary accommodations for disabled individuals. D. Consider both mental and physical disabilities. 119B. Provide reasonable accommodations for disabled individuals. The law is designed to permit persons with disabilities access to job opportunities. Employers must evaluate an applicant's ability to perform the job and not discriminate on the basis of a disability. Employers also must make reasonable accommodations. 120. Upon completing the admission documents, the nurse learns that the 87-year-old client does not have an advance directive. What action should the nurse take? A. Record the information on the chart. B. Give information about advance directives. C. Assume that this client wishes a full code. D. Refer this issue to the unit secretary. 120B. Give information about advance directives. For each admission, nurses should request a copy of the current advance directive. If there is none, the nurse must offer information about what an advance directive implies. It is then the client's choice to sign it. In option 1, just recording the information is not sufficient. In option 3, the nurse should not assume that the client has been informed of choices for emergency care. In option 4, this represents an inappropriate delegation approach. 121. A client with a diagnosis of methicillin-resistant Staphylococcus aureus, MRSA, has died. Which type of precautions is appropriate to use when performing postmortem care? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Compromised host precautions. 121C. Contact precautions. The resistant bacteria remain alive for up to 3 days after the client dies. Therefore, contact precautions must still be implemented. The body should also be labeled as MRSA contaminated so that the funeral home staff can protect themselves as well. Gown and gloves are required. 122. An 8-year-old client is admitted to the hospital for surgery. The child's parent reports the allergies listed below. Which of these allergies should all healthcare personnel be aware of? A. Shellfish. B. Molds. C. Balloons. D. Perfumed soap. 122C. Balloons. Allergy to balloons indicates a latex allergy. All personnel in contact with the child will need to be aware of this condition and use non-latex gloves. 123. A nurse is stuck in the hand by an exposed, used hypodermic needle. What immediate action should the nurse take? A. Look up the policy on needle sticks. B. Contact employee health services. C. Immediately wash the hands with vigor. D. Notify the supervisor and risk management. 123C. Immediately wash the hands with vigor. The immediate action of vigorously washing will help remove possible contamination. Then the sequence would be options D, A, B. 124. The nurse is having difficulty reading the healthcare provider's written order that was left just before the shift change. What action should be taken? A. Leave the order for the oncoming staff to follow up on. B. Contact the charge nurse for an interpretation. C. Ask the pharmacy for assistance in the interpretation. D. Call the provider for clarification. 124D. Call the provider for clarification. Relying on anyone else's interpretation is very risky. When in doubt, check it out with the person who wrote the difficult-to-read order. Order entry systems help to minimize this problem. 125. When admitting a client to an acute care facility, an identification bracelet is sent up with the admission form. In the event these do not match, the nurse's best action is to A. Change whichever item is incorrect to the correct information. B. Use the bracelet and admission form until a replacement is supplied. C. Notify the admissions office and wait to apply the bracelet. D. Make a corrected identification bracelet for the client. 125C. Notify the admissions office and wait to apply the bracelet. The admissions office has the responsibility to verify the client's identity and keep all the records in the system consistent. Making the changes puts the client at risk for misidentification. Using an incorrect identification bracelet is unsafe.